I'd like to begin by expressing my sincere gratitude to our sponsor, Alpha, a Japanese shampoo company, who made this lecture possible and allowed us to invite Dr. Rei Ogawa, who will be presenting here today. And since we have no information about Dr. Rei Ogawa, I'd like to introduce him a little bit. So Rei Ogawa obtained his MD and PhD degrees from Nippon Medical School in Tokyo. He is currently a faculty member at the Nippon Medical School in Tokyo and holds a position as an associate professor at the Department of Plastic Surgery. Also, he is a visiting lecturer at the Department of Plastic Surgery in Tokyo University from April 2013. He is a fellow of American College of Surgeons. In addition, he is now the director of the Mechanobiology and Mechanotherapy laboratory at his medical school. He joined the Tissue Engineering and Wound Healing Laboratory at Brigham and Women's Hospital, Harvard Medical School, Boston, where he worked between 2007 and 2009 as a research fellow. His recent studies were focused on the mechanobiology of cells and its application to tissue engineering, wound healing, and anti-aging medicine. He established a method to regenerate high-quality cartilage using mechanical force loading. Moreover, his clinical specialty is reconstructive surgery and scar management, for example, abnormal scar prevention and treatment. In relation to this, he studied mechanobiology of scarring, and he is a world leader in this area. He was a recipient of several awards and numerous research grants. Moreover, he holds several national patents in the field of tissue engineering. He has co-authored over 50 chapters in international textbooks, co-authored over 320 papers in international scientific journals, and has presented over 910 co-authored papers at international conferences, including over 160 invited lectures, including this conference. So, ladies and gentlemen, it's my pleasure to introduce Dr. Rei Ogawa.
Thank you very much for your kind introduction. So I'd like to talk about the possibility of mechanotherapy for hair regeneration. So I came from Tokyo, Japan, and I'm a basically plastic and reconstructive surgeon. And I'm doing both clinical works and the research. And my research area is mechanobiology. So I'd like to talk about the possibility. So at first I'd like to introduce mechanobiology. So please think about the astronauts. That when they come back from outer space to Earth, they can't walk and they cannot stand because the human body is maintained by the physical and the environment of the Earth, And I guess every kind of organisms maintain structure of their body by physical and physiological environments. So I think that they feel water pressure and they feel atmospheric pressure, and their body is constructed and their body is maintained. So I think that if organisms were developed in other planets, I think the structure of their body would be more different. So for example, Jupiter, the gravity force of Jupiter is 2.4 times higher than Earth. So maybe our organisms were developed in Jupiter. Maybe our body structure would be more flat. Maybe would be more different, I think. So the maintenance of our body structure is very, very important. And 1999, this is a very very famous human ear mouse. So, but 15 years have already passed, but not yet clinically applied, because the maintenance of this such structure is very difficult in our body, and the absorption is a problem. So, because the reason is this ear can't sense the physical environment. So, I have studied the cartilage regeneration using stem cells previously. And we have tried to regenerate cartilage, but the problem is its size, the limitation of size. So, of course, not only mesenchymal stem cells, but adipose-derived stem cells that can be regenerated, and the cartilage can be regenerated. But the size is very limitation. Just small cartilage is regenerated. So this is a typical example of mechanosensitive cartilage, the articular cartilage. So we have to think about more seriously about the natural body status. So in the case of articular cartilage, the articular cartilage is contacted with fluid, and when we walk, very, very high hydrostatic pressure. This is a 300-meter depth of sea, 30 atom. So if we want to regenerate such cartilage, we have to provide very strong pressure. This pressure is very important. So do you think if you want to regenerate cartilage of astronauts, do you want to inject stem cells? I think this is not the answer, because environment is much more important. So before inject stem cells, we have to make environment at first. Especially physical environment is very important. So if you want to regenerate hair, maybe just stem cells is not the answer. The environment, we have to understand the environment more seriously, I think. So by the way, we turn back to the cartilage regeneration. So this is my previous experiment. So we have tried to regenerate cartilage using hydrostatic pressure. So we have provided very cyclic high hydrostatic pressure in the incubator. And stem cells is seeded onto the collagen sponge, and the sponge is put into this device, and culture with hydrostatic pressure started. And in the results, the high hydrostatic pressure groups could regenerate very tight and very high quality, and large cartilage could be regenerated. This was very interesting observation. So what was happening in such cells? The study of mechanisms of sensing mechanical forces by cells is a mechanobiology. So I'd like to talk about mechanobiology today. So Dr. Ingbar in Harvard have speculated that cytoskeleton may be vital to control or regulate cell growth. So because the cells move every day and that shape is changed, and cytoskeleton is very important, Dr. Ingbar said. This is a tensegrity theory of mechanobiology. So actually, not only tensegrity theory, but also many mechanoreceptors and mechanosensors are existing on the cells. So on the cell membrane, the integrin or maybe other kind of cell adhesion molecules existed. And for example, when we stretch skin, the matrix is also stretched. So at that time, integrin can sense mechanical force. And this mechanical force is conducted to actin filament, and actin filament is also connected with calcium ion channels. So when we stretch skin, the many types of cells can sense mechanical force via integrin or other adhesion molecules, and in the last, the calcium ion is infiltrated into the cells, and gene expression will be changed. This is one of the mechanisms of mechanobiology. And after that, many mechanosignaling pathways are activated. This is just activated by mechanical force. There are many pathways are known. And one of typical mechanosignaling pathways is TGF-beta smart signaling. This is very important for fibrosis or other diseases. But a very interesting issue is if we apply mechanical force, this signaling pathway is activated. But TGF-beta ligand itself is not necessary. We don't need TGF-beta. Just stretch the cells, this signaling pathway is activated. This is very interesting things. So now the many mechanosignaling pathways are started to analyze. TGF-beta SMART, integrin, MAPK, TNF-alpha, Wnt pathways, calcium ion signalings, and the prostaglandin and signalings. So such pathways are depending on cell types. For example, the cartilage, the chondrocytes, calcium ion signaling is very important and very sensitive against these signaling pathways. But in case of fibroblasts, TGF-beta is very important, and such signaling pathways are different by cell types, each cell types. So why cells can sense mechanical force? So I believe that in the course of evolution of our life on the Earth, at first unicellular organisms were developed, and after that multicellular organisms were developed. At that time, the cell adhesion molecules are developed also. And at that time, the cells started to sense mechanical force via cell adhesion molecules. So in the Earth, on the Earth, we are sensing mechanical force via such kind of integrin or adhesion molecules, many molecules on the cell membrane. So this is vital to control cell life. So please look at this. The cells is connected and multiply and every day moving. So mechanobiology, we have to start to think more seriously, especially in hair regeneration. And of course, the analysis of disease mechanobiology is very important, and not only analysis, but also acceleration of wound healing mechanobiology is very important. And the tissue engineering, we have already started to apply mechanical force. And maybe in the future, cancer cells, stem cells, progenitor cells, iPS cells, maybe can be controlled. And the word mechanotherapy has been used in the area, basically orthodontics or rehabilitation using machine. But I believe in the future, mechanotherapy should be used much more wider meaning. So this is intervention by mechanical means at the molecular, cellular tissue level in the future. So we publish this terminology of mechanotherapy. We believe we should revisit the terminology for much wider meaning in the future. So I believe in the area of hair regeneration, the mechanotherapy will be very important in the future. So especially the interesting things is collagen-rich tissues and the musculoskeletal systems can sense mechanical force easily. The bone, cartilage, muscle, tendon, ligament, dermis are sensitive against mechanical force. But adipose tissue, for example, adipose tissue is less mechanical force sensitive. Because when we apply mechanical force on adipocytes, adipogenesis is inhibited. So I guess in our body, when we apply mechanical force, the bone, cartilage, and musculoskeletal systems is developed, but adipose tissue is decreased. So this is balance. So less mechanical force loaded area, adipose tissue is accumulated, I suspect. So in the case of hair, so this is dermis, and the hair follicle is in the dermis, and papillary cell, dermal papilla cells is here. So I believe the mesenchymal tissue, papillary cells and papillary, the dermal papillary cells can sense mechanical force much more easier. And maybe we can apply mechanical force to the dermis, and maybe we can control hair growth. So there are many types of mechanical forces. So when we apply mechanical forces clinically, we have to think about the types of mechanical forces. Maybe you can easily imagine tension and compression, but also shear force can be used, hydrostatic pressure can be used. Maybe we can apply osmotic pressure for cells. So this is very interesting experience to me, bone repair and regeneration. I'd like to show you. In our body, bone senses mechanical forces via maybe a tendon or pressure by body weight. So I believe the bone in our body does not feel water pressure in natural status. But we tried to regenerate bone using hydrostatic pressure device I used for cartilage regeneration. So similar method, hydraulic shear apatite I use, and human mesenchymal stem cells is harvested and seeded onto the scaffold and put into the device in the results. And after that, hydrostatic pressure is provided. And the hydrostatic pressure groove could be regenerated, very, very good, very high quality bones. This means, I think that usually in natural status, bone does not feel hydrostatic pressure, but the osteocyte can sense hydrostatic pressure, water pressure, in my experiment. So I believe every kind of cells have a capacity to sense every kind of mechanical forces, maybe. So mechanical force is a very primitive stimulation against cells. And cells can sense mechanical force every day and regulate their gene expression. So in clinically, there are many mechanical forces already applied. But we can combine these therapies as mechanotherapy in the future. So one of typical clinical cases, clinical treatment is destruction osteogenesis. So such kind of bone is cut and every day elongated 1 millimeters per day. And in the result, the osteocyte on the edge of bone can sense mechanical force. Maybe not only osteocytes, but also fibroblasts and every kind of cells can sense mechanical force every day. And very strong matrix of bone is regenerated. So I think the cells sense mechanical force, and to protect themselves, they start to secrete collagen and protect themselves. So, and another very good example is a negative pressure wound therapy. Maybe you know NPWT. This is a kind of device, and when we attach the device to such kind of chronic wound, this is healed without any surgery, just closed. This is very amazing technique. And we are plastic surgeons, so previously we selected surgical methods, but now, so just NPWT is applied here, and within a month the wound is healed and becomes very easier to treat. So this is just mechanism, just foam is applied to the wound and sealed, and vacuum is started. Just such procedure can heal wound healing, accelerate wound healing. So this is a diabetic ulcer. So traditionally the amputation and suture and ischemic area occur, and the wound is opened and another amputation is needed. But now just necrosed area is removed, and just we don't need to suture, and just open and apply sponge, foam, and vacuum is started. And 3 weeks after treatment, the naturally closed, and after stopping treatment, the 3 weeks after stopping the device, the closed. So what is this mechanism? This is one of the mechanisms is a deformation of wound. So when we apply foam to the wound, and after starting vacuum, the foam is contracted, and the wound surface is deformation occur like this. And at that time, the very high mechanical forces are applied on the wound surface. And the water pressure, not only water pressure, but also shear force, the matrix are distorted, and cells in the wound can sense mechanical force directly. And we have analyzed its mechanisms in vitro, and we have made a model of vacuum-assisted closure. And in the results, the cell number is proliferated dramatically after starting vacuum-assisted closure. And cell shape was also changed. Looks like just a bipolar fibroblast is changed to the multipolar cells, looks like nerve cells. And also, many gene expression were changed to accelerate wound healing, basic FGF, collagen, and alpha-smooth muscle action. And TGF-beta1 is also upregulated. This is one of the mechanisms of vacuum-assisted closure, negative pressure wound therapy. So this is the in vitro analysis of NPWT. This is a diabetic mouse. And when we apply foam and start vacuum, the wound is naturally closed, but this is a control group. This is just occlusive dressing therapy. Just a film is applied. And this is just foam is applied, and continuous vacuum. And this is a cyclic vacuum. This is a cyclic application of mechanical force. At first glance, there are not so big difference. But in the histologically, the negative pressure applied group is thickness of collagen, thickness of granulation tissue was much higher than control groups. This is very important things. So fibroblasts are activated by such device and secreted collagen more. And another very interesting issue is vessel is also remodeled. Remodeling was performed. And this is a diabetic mouse vessels. This is non-functional, very bad structure of vessels. But after applied mechanical force, the remodeling of vessels is occurred and very soft and very straight angiogenesis was occurred. So also nerve fiber is increased in diabetic mouse and substance P or maybe factors for neurogenic inflammation increase also. So every kind of tissues, cells, vessels, nerves can sense mechanical force and accelerate it in the healing. So in clinical application, we can choose convenient mechanical forces for clinical application. So maybe not only tension, but also vacuum, negative pressure, shear force compression, every kind of mechanical forces we can use. So this is a very interesting example of application of mechanical force for accelerating wound healing. Extracorporeal shockwave therapy. So this is very famous for treatment of kidney stone. But this device can be used for acceleration of wound healing also. So when we apply shockwave, very weak shockwaves, the cells in the wound can sense mechanical force and they protect themselves, they want to protect themselves, and in the result, they secrete collagen and wound is closed. So in the results, the diabetic wound can be healed relatively fast. So I think this is a in vitro study. When we stretch the cells, this is fibroblast. The cell activity and the proliferation is migration activity is very stimulated, highly stimulated. So cells need to protect themselves by mechanical forces, and they want to make house. So collagen is started to secrete and protect themselves. So sometimes this kind of mechanical force cause disease or disorders. This is keloid, you know. So keloid is a very famous. The keloid has a favorite site on the. They are mainly developed on the high stretching force area, such as chest wall, anterior chest wall, and the scapular area or lower abdomen. So in case of lower abdomen, always we stand and sit, repeated standing and seated. So stretched on the vertical direction, and in the case of chest, always horizontally stretched. And this is a vaccination keloid. Please look at this. This is very characteristic shapes, butterfly shapes, dumbbell-like shapes. So we have very interested in this shape and the relationship between mechanical force. So this is computer simulation we perform. This is keloid. This is keloid. And when we stretch when we stretch skin, this direction, horizontal direction, the high stretching area occur here. So please compare to the clinical appearance. Very similar. So I believe that this edge, the keloid edge, is always sensing mechanical forces too much. So such information is maybe driven by mechanical force, stretching force. So in case of upper arm, in the development of, in the growth, when children, the younger age, the injection is performed and the inflammation is continued, and when we grow, the upper arm is stretched this direction. So always the high tension is arised on the edge. So inflammation is continued on the edge. So I believe inflammation can't be stopped by cyclical stretching force by daily movement of our body. So I believe keloid may be a typical mechanobiological disorder. So this is my one of expertise of clinical works of keloid treatment. And very interesting thing is that even if the patient has multiple keloid on the body, the less mechanical force loaded area is the keloid is a very rare. So please look at this patient. Keloid clearly the body constitution existed. Of course, SNPs may be a genetic predisposition existing, but there are no keloid on the anterior lower leg and no keloid on the scalp. So please try to stretch your scalp. It is very difficult to apply mechanical force. It is difficult to stretch. So please try to stretch your anterior lower leg. It is difficult to stretch. So even if the patient has a keloidal predisposition, maybe constitution, keloid does not develop on such patients. So maybe mechanosignaling pathways are closely related to keloid generation, I believe. So now we are studying the mechanosignaling pathways in the keloid tissues. But we are physicians, so we have to treat keloid and the hypertrophic scars in clinically. So genetic predisposition is difficult to control in clinical work. So we have to do surgery to release tension, and the mechanical force can be controlled by surgery. So Z-plasty is one of good examples. So for such kind of orthopedic surgical scars, the zigzag suture is performed using Z-plasty. So this is immediately after surgery, 3 months after surgery. Please look at this. The hypertrophic scar recur this direction, but this direction, so naturally almost healed. So scar is segmented. So 6 months after surgery, then this is 1 year after surgery, almost disappear. This is amazing things. So the very long scar can sense mechanical force too much, but the segmented, very small scars is difficult to sense mechanical force and naturally healed. So inflammation is already stopped by just mechanical force reduction. So this is also, I think that this patient does not have body constitution of hypertrophic scars and keloids. But unfortunately, the mobile area, he received injury, burns. So hypertrophic scars is arise. So just the multiple Z-plasty will be fine for such cases. The zigzag plasty and 1.5 year almost disappeared, and contracture is completely released. So in the case of keloid, the surgery and on the just one Z-plasty on the center, And of course, in this case, we use radiation, but 18 months after surgery, almost disappeared. Aesthetically, it's very good, I think. So not only zigzag line suture, the direction of skin stretching is also very important. So when we incise this direction, and when we stretch this direction, the high tension is alive entire incision line. But if we put incision line 90 degrees different from the stretching force, so mechanical force is distributed. For example, cells in here can sense less mechanical force. So when we stretch skin 100 grams, maybe these cells can sense just 1 gram of cells. But these cells can sense 100 grams. All of grams they sense. So entire region will become high stretching force and risk of hypertrophic occur. So I think the direction is very important. So when you cut the chest wall, the direction is horizontal direction. So we don't cut like this because a butterfly shaped keloid may arise. So we have to cut like this. But in the case of lower abdomen, the stretching direction is vertical. Rectus abdominis muscle is existing long, the vertical direction. So if it's cesarean section, if we cut, this will be a hypertrophic risk. So a horizontal incision is more or less risk, more better. And of course, when we suture, much more the keloid and hypertrophic scar developed from the dermis. So we have to release the tension on the dermis. Much more deeper tissues should be sutured and release tension. So maybe you have to find fascia, deep fascia, and suture tightly. So in such cases, the keloid and hypertrophic scar is removed, and deep fascia of muscle is sutured. And naturally, the status, naturally, the wound edge is naturally attached after fascia suture. The dermis is not yet sutured. And after that, the dermal suture is minimally put, and the wound surface is closed, very small sutures. And also, after operative fixation is very important. And in the result, 6 months after surgery, the still gentle elevation is occur. So tension on the wound is very minimum. And 2 years after surgery, almost disappeared. This is just a difference of surgical techniques. So such case, just a mature scar can be treated by similar techniques, mechanical force releasing. So when we cut, you can see such a high tension is occur on here. So and after that, the suture like this, the fascia level suture is performed, and dermis is sutured, and 2 years after surgery, almost the width is improved dramatically, I think. So mechanosignaling pathways is very important for scar management, and I think that there are many future possibilities in the research field in dermatology and plastic surgeons. So I believe there is a possibility that mechanical force is important for hair growth and maintenance, and maybe we can control mechanical force and maybe accelerate hair growth. So a study of the effect of mechanical forces, study of mechanobiology on dermal papilla cells is necessary, I believe. So because as I mentioned before, the dermis is very sensitive against mechanical forces. So dermal papilla cells is a mesenchymal tissues and control hair growth. So maybe we can apply mechanical force. The dermal papilla cells may sense mechanical force from the beginning and can be control the hair growth. So also dermal papilla cells has speculated as looks like stem cells have a lot of capacity to regenerate many tissues and maybe secrete cytokines. So we have focused on the cell culture and the application of mechanical forces on dermal papilla cells. So we culture the human dermal papilla cells and cell stretch device using, and dermal papilla cells is stretched, and the gene expression were analyzed using cDNA microarray. And after that, bioinformatics analysis of signaling pathways was performed, and gene expression analysis was performed using RT-PCR. And at first, we applied 24 hours stimulation against dermal papilla cells. And in the results, the 1% of human genes, about 300 genes are upregulated and 400 genes are downregulated. But we could not get not so interesting genes related to hair growth, so we stimulated more. 3 days we elongated the stimulation times, 24 hours to 72 hours. And extension rate is 20%. Directly cells is stretched, and what will be happening we observed. In the result, the 2,000 to 3,000 genes, the 10% of genes expression were changed by just stretch of dermal papilla cells. This is 10% of total number of genes, human genes. So in the results, very interesting result we could get. The BMP4, NOGIN, and SMART4 is increased significantly, and the interleukin-6 and the stimulation factor of interleukin-6 decreased. So I focused on the BMP4, SMART4 signaling pathways and NOGIN pathways. And I guess the balance of BMP4 and NOGIN is very important to regulate hair growth, as you know. But as you know, BMP4 and NOGIN is also very important in the bone regeneration. So bone is a mechanosensitive tissues, and maybe some common pathways existing in bone regeneration, or maybe hair regeneration and maintenance of structures. And this is a paper published in Nature. The NOGIN and the balance of NOGIN and BMPs is very important in each stages. And for example, Dr. Prikos said the autonomous anagen stage, the NOGIN is high and also BMP is high. But refractory telogen stages, NOGIN and both NOGIN and BMP, just NOGIN is low and BMP is still high. And propagating anagen stages, NOGIN high and BMP is low, and competent telogen stages, BMP is high but NOGIN is low. So when we stretch dermal papilla cells, so we could make the stage of high NOGIN and high BMPs. So maybe we can, this is just speculation, but if we apply appropriate mechanical force on dermal papilla cells, maybe we can change propagating anagen stage to autonomous anagen stage, maybe more competent telogen stage to anagen. Maybe we can change telogen stage to anagen if we apply mechanical force. But I think of course, you know, the too strong mechanical force is not good. So maybe injury occur. So, but too weak mechanical force is also not good. Does not any effect. So appropriate mechanical force we have to find. But if we find appropriate mechanical force on dermal papilla cells, clearly we can accelerate hair cycle, I believe. So previously I studied the computer stretch of dorsal skin of mouse. When we stretch the skin of mouse, we applied cyclic mechanical force. And in the result, angiogenesis is accelerated, and dermal cells is started to proliferate. So we have already published this paper. So I think that not only also a lot of gene expression was changed, just stretch of skin. So, and also angiogenesis is accelerated after stretching of mechanical forces. So I believe the mechanical forces on the scalp maybe increase blood flow, not only increasing blood flow, but also maybe stimulate directly dermal papilla cells. But of course, the too strong mechanical force is not so good, so we have to find appropriate force, and it is important to continue mechanical force application. So strongs and terms we have to consider seriously. So I believe the mechanotherapy, mechanobiology is very important for field of hair regeneration and hair growth when we think. So I would be happy to collaborate with you if you are interested in such works. I'd like to discuss more, and we will have a session about mechanobiology in the mechanotherapy session in Japan next week. And I have organized the mechanobiology and the mechanotherapy laboratory in our Nippon Medical School in Tokyo. So if you are interested in, please contact me, and I will be happy to collaborate with you. And finally, I'd like to thank to my colleagues in both clinical works and the research works in Josai Clinic, Amphar Corporation, and Dr. Kawakami, and many other colleagues in US, in Japan. So thank you very much. So I welcome your opinion. And if you have any questions. Thank you very much.
Thank you for your impressive talk, Rei. So I expected many questions and comments from the floor. So any comments, questions?
Epithelial cells and the
Yes.
mesenchymal cells. So how about the mechanical force on epithelial cells, especially stem cells, epithelial stem cells?
Yes, so clearly we have to study in the future, but not yet. I think I have focused on mesenchymal tissues. So at first I studied dermal papilla cells, but in future, of course, the hair cells itself, I have to provide mechanical force, and what will be happened, I have to.
How about the other epithelial cell type, the mechanical force to expect any effect on epithelial cells?
Epithelial cells?
Yeah.
So in case of skin, it has known the cell proliferation is accelerated. Proliferation is accelerated. There are some papers. And also skin surface is very sensitive against mechanical force. So nerve endings is existing, and nerve fibers can sense mechanical force directly, and neurogenic inflammation, as you know, occur. So mechanical force should be studied related to epithelial cells, but not yet deeply studied, I think. So this is the future topics. Very good question. Thank you.
Thank you for your nice talk, and I'm from Seoul, Korea, and I just want to ask you the mechanism of the treatment. Recently, I'm a laser surgeon, and recently US doctors are reporting many cases about treating contracted scars using multiple fine laser-induced holes on the skin surface and using carbon dioxide fractional laser systems. Do you think that it also involves the mechanism of your talk. What do you think
I
about
think
that?
in the laser therapy, in my experience, CO2 laser, carbon dioxide laser, fraction laser does not work well for hypertrophic scars and keloids. But NDR or dye laser, the target is better, is very effective.
But
Because
in US Navy doctor, they reported that many successful cases using fractional CO2 laser,
Yeah,
they
but,
reported that the parameter is very specific. If they use
Yes.
specific parameters, they can
Yes,
treat some
yeah, I know. But
cases.
sometimes inflammation is accelerated by carbon CO2 laser or fraction laser. So sometimes get keloids worse. So, but interesting things is that why NDR and dye laser works well for pathologic scars, because angiogenesis is accelerated by mechanical forces. So angiogenesis is, if we stop, the volume is reduced, and I have experience. So maybe we have to target vessels more. But in my opinion, the CO2 or fractional laser, the relation about the mechanical force is, I cannot imagine at this stage, but maybe it is interesting in the future. Thank you.
So, any other question, comment? No? So the audience is so modest. I have two questions. The number one, you showed shockwave device for wound healing treatment. Why don't you try that device on the scalp of hairless patients?
Yes, I think it can be possible, but company of the device does not recommend to use such device for head, because the brain, existing brain, so maybe shock waves sometimes penetrate the scalp. Maybe there is a possibility. So company does not recommend. So, but maybe similar products we can develop. I believe.
And number two, during your wound healing study with mice, have you ever seen rapidly hair growth with the treated wound? I mean, it's the wound healing study, I know, but during the experiments, have you ever seen such difference?
Yeah, when we study the stretching device, yes, it's 4 or 5 years ago. So at that time, I didn't focus on hair growth, so I didn't observe. But maybe hair growth is accelerated or something changed was observed. So yeah, I'd like to do this study again in near future. Thank you.
Any comment? So thank you very much, Rei and all the participants. Thank you very much.
Thank you very much.